Hey everybody, this is Devin with Homeschool House Calls. You're in for How Do I Homeschool Facebook group. And today we have an awesome lineup. We've got Susan from Homeschooling Supermoms and Amanda from Illuminate Communicate. Am I saying that right?
Yep, you got
I
it.
was trying to read it. I have old eyes sometimes. But Amanda is one of my new friends, and y'all just don't know. She is just like a breath of fresh air, and she's going to talk today. Let me pull that up. We're going to talk about how do I know my child needs speech therapy, which is something we get asked a lot in our groups, and it is a very valid question.
Mhm.
But Amanda, I want you to tell us a little bit more about yourself.
Oh, well, I do have a slide for this. So if we could pop that up.
Oh, yeah, we
Yeah,
can.
because otherwise I'll be telling you about me twice, which just seems so very self-centered.
No, it's
But,
not.
yes, but I'm Amanda from Illuminate Communicate, and my goal is to support speech therapy at home by equipping parents to either practice or do what they want to do at home to the best of their ability, because parents are, as I like to call it, the secret sauce in speech therapy progress. Whether you're flying solo or you're with a speech-language pathologist, you make a difference, a statistically clinical research-based difference in your child's ability to make progress. So that is me and my company in general. But we're going to be talking about how you know if your child needs speech therapy and what to do about it today, like Miss Devin said. A little bit about me. I am a homeschool high school graduate. I kind of did it backwards. I was homeschooled 8th grade on up just to be difficult. And I spent the last 10 years as a speech language pathologist, working all the way across our very, very diverse field. And I've had little ones as young as a few days old, all the way up to helping a 104-year-old work on being able to eat her 105-year-old birthday cake. I know, isn't that kind of crazy? Literally such a wide span in speech language. But I'm a home birthing and homeschooling mom of 4, and I like to always include something goofy about myself just to break the ice for me. And I really love Brussels sprouts. I also like lima beans and any other very non-picky eater friendly food. They tickle me, especially in the green variety. If it's green, I'm all a go for it. But that's me.
I
You're the
love
kind
those
of
too.
eater that every mama dreams to have.
Oh, I was not always. I was not always. I still remember one of my very first sessions at a local hospital. I was doing feeding, and I was working with a child with obsessive compulsive disorder, and he had a difficulty with food, touching food. And it was my job, because it's social, eating is social, to eat with the child. And I was like, we're going to do what? And the other speech language pathologist, my senior officer, if you will, she said, well, we're going to take these graham crackers and we're going to dip them in the strawberry yogurt. And I was like, we're going to do what? Textures. Green things, yes. Textures, woo. Can't even eat oatmeal unless it's in a cookie, and then I will eat that oatmeal.
Cookies seem to cure a lot of things, don't they?
Ooh, they really do. Cookies are freaking fantastic. They're just absolutely the bee's knees. One of the best things I've ever done in my life was eat cookies every day for breakfast for a year.
That's not a
Ooh,
bad
that sounds.
thing. I like that.
No,
I do
no, it is
too.
not. I made much healthier decisions later on. And yeah, if you guys ever want to hear about my thoughts on picky eaters, you'll learn more of those kinds of tips and tricks and things that you wouldn't expect, but actually make a big difference in the long run.
Oh my gosh.
I know. Now I'm going to be giving you full permission to eat cookies. That's worth signing up for, isn't it?
Yeah,
Yeah.
absolutely.
Yeah, for sure. So today our goal is very simple. My goal is to show you a reliable place to look for information on typical language development, typical speech development, typical social language development, and even feeding and swallowing, all kind of in one stop shop. Because speech therapy is so all encompassing, it's something where I could list all the milestones for you, but we'd probably be here for 4 or 5 hours, which I'm pretty sure Miss Devin and Miss Susan have not signed up for. But what I want to do is show you, equip you how to find what you can rely on and maybe what you should probably skip on in terms of looking for resources to determine whether or not your child might need a look at or might need some help in a certain area. And that's what we'll be doing today. So a question I often get is, well, shouldn't I just wait and see? Because, every kid is a little bit different. But to be quite honest, it's very hard to be objective when it's your own child. And sometimes it can be helpful to have something to go off of, whether or not that's contacting an expert. And I have recommendations on which kinds of experts will actually give you bang for your buck or the information you really need. And then it can also be just using guidelines, just having a guideline to look off of instead of comparing your child to the kid on the swing next to them. For one thing, that's never fun to compare your child to other children because they are different and the range is so wide. But if you have something that gives you that bare minimum of, hey, your child should be doing this, and if they are, they're probably okay, then you can feel a lot more confident about that because it's hard not to worry. It's so hard not to get in that panic place either. So you have those two options. You wait and see or you panic. And I'm trying to give you a middle ground. That's kind of my goal. And one of the things that I'd really like to impart to you is your pediatrician may be really fantastic at helping you solve all of your child's just health needs. You might have a wonderful chiropractor or an osteopath or a naturopathic doctor. Whoever your general medical practitioner is, they are probably really fantastic at what they do. However, when it comes to speech and language and even sometimes feeding milestones, a lot of times I get funny stories back about doctors who know when it's really bad, but they don't necessarily know when a child's on that border. Or maybe that's just not their sharpest area. They're wonderful if your child has an illness, but they're not necessarily the ones to go to when you have speech or language concerns. And part of that is because they didn't go to school for 3 years to learn about speech and language disorders. And most of us, we went to school for 2 to 3 years after also getting a bachelor's degree in it. So we spent, a large percentage of our time learning the ins and outs on speech and language development. And a doctor, they're busy doing way more important things like how to fix a broken leg, all those kinds of things that you really, really need to know for their line of work. So it's one of those specializations kind of things, which isn't too bad. So when in doubt, I always listen to mom. If mom has that little achy feeling where they're not quite sure, even if your doctor's saying, oh, they're probably fine, go take a look at some milestone charts. I think you can really default to you. How are you feeling? Because even if you you are off base, wouldn't you feel better if you could just take a look at something and get an idea that you could give you an objective perspective? Probably it would make you feel a lot better. So where I would recommend that you look for developmental milestones. Right now, there's a lot of drama. There's a whole lot of drama in the speech and language world, in the occupational therapy world, and in the physical therapy world, because the CDC, the Center for Disease, CDC is the Center for Disease and Control. Yes. Control. I was like, where's that other C? They have come up with new milestones. And in general, each one of those individual professions is very concerned about these milestones because they don't reflect the research literature on what actually is typical development. And while it stays pretty close to what it is in the younger ages, it gets very different as the child goes older. And I'd love to give you an example. The American Speech and Hearing Association is a contrast to the CDC. They are our governing board as speech-language pathologists. So if you have questions about whether or not your child needs speech therapy, my recommendation would be that you go to the specialist for it. If you had, difficulty with an orthopedic concern, you wouldn't go to a heart surgeon. you'd go to an orthopedic surgeon, most likely, right? You want somebody who's done that thing before and done it a whole bunch. In fact, they do it 40 hours plus every week. You want somebody it's very fresh in their mind. It's something that they do really well. And so that's why I would argue that you need the American Speech and Hearing Association's information. It's really easy to find, asha.org. And I have an easy time remembering it because one of my bridesmaids' name is Asha. her name, it was so good. It was so good. When I got certified by Asha, I told her, I knew you liked me, because you certified me, Asha. But one of the ways I'd love to contrast, I have pulled up a contrast of the CDC's guidelines and the American Speech and Hearing Association guidelines. And the CDC is saying that their expressive milestone for a child who is 30 months, so 2.5, they should be saying about 50 words. But research shows us that to be at the bare minimum of normal, to be at the bare minimum of average and not qualify for special education or not qualify under an insurance company as a child with a delay or a disorder, they have to have 412 words. Let's just take a moment to contrast that. 50 words is the CDC recommendation versus 412 words is the research.
That is a big difference.
That's a very big difference. And I think it's incredibly important to highlight those differences, not because we want to beat up on the CDC. As some of the sweeter people who've been sharing their concerns have said, we appreciate that the CDC wanted to update their guidelines. That's wonderful. They should continuously update. But there was no speech-language pathologist in the room when they updated the guidelines for speech and language. And that's a bit of a pickle because when you don't have someone who knows that really well, it's going to be harder to gauge what's accurate and what's not. So I think that's very shocking. And for me, from a practical standpoint, that can cause problems as a child is getting older. If they're not learning speech and language at a young age, they're missing what's called a critical period, which we'll talk about in a little bit. One of the things that I also want to share with parents is to expect rationalization. The CDC is who the American Pediatric Association, they take a lot of their guidance from them, rightly so. They are a government entity and they're kind of a go-to. They're a great place for one-stop information because they hold a lot of information. But what might happen is more pediatricians, because they're following the information they've been provided, they might not be as receptive to a mom who has concerns because maybe her child is 2.5 and they have 200 words because they're like, oh, but he only has to have 50. They're doing great. But in reality, they hit that marker for being diagnosed by someone who actually can diagnose a speech or language delay, and that would be a speech-language pathologist, as being quite considerably delayed because they would only be at half of what they should see. So when in doubt, you can always ask a speech-language pathologist, or like I said, use that American Speech and Hearing Association, asha.org, milestones. And they are broken up so beautifully. They have it broken up into social language or pragmatic language skills, and they're so readable. They have it broken down into speech sounds. Again, so readable, so easy. Comparatively to, what you would expect out of a governing board, they really do all right. So they're a great place to look. And if you ever have questions, obviously I'm around and I'll talk more about that later. But how to read developmental milestones. What's a milestone versus say, what's a percentile? So a milestone is considered that bare minimum of how a child should be doing before you should be concerned. But little known story about milestones, they're actually different depending on who the source is. Different places, they rate milestones differently. The CDC, part of the reason why they wanted to do that change, which was, a lovely thought, was they wanted to change their milestones. So they were only flagging the bottom 25%. That was their goal. Now, obviously, they didn't necessarily hit that accurately with the milestones that they chose. However, they're not wrong about that 25%. If a child is in the middle 50%, we consider that average. If we see a child who is in the top 25%, then they're above average. And if they're in the below, like the lowest 25% of all children who are surveyed or research, one of the research subjects, then that bottom 25% are the ones we're like, ooh, they are considerably below average. And that actually keys into a percentile. So a percentile is based on that curve, where most of the kids in the world are going to be in that middle 50%. And we have our above average and we have our below average. And in that below average, all the way up through the above average, we have percentiles. And I'm sure some of you guys are thinking about percentiles with standardized tests. Yes, like the SATs, et cetera. Those percentiles are kind of hard to read because you're sitting there going, oh no, my kid only got 50%. Oh, that's a horrible score on a test, but it's a standardized assessment. And it means that they were the 50th percentile. That means they were smack dab in the middle. Fantastic. They did so great. They were better than about 50% of the children in that testing cycle. And they were, right below 50. Wherever they just happen to flow in the percentile. So if we see a child who is below the 25th percentile on any standardized testing, we get quite concerned, which is why it's important to check when you're looking at milestones. It's important to check to see what their percentile is, whether or not they're 75th percentile, which would red flag everyone, make everyone, panic and worry that their child needs speech therapy, versus the 25th percentile. That's a little bit more appropriate. And then the 3-month rule, when children are itty bitties. So if they're younger than 3 or 4 years old, the general rule is you want them to be within 3 months of their milestone. Obviously, with the CDC's changes, that kind of changes things. But that 3-month range can be very helpful when you're looking at asha.org or other ones that are similar. You want to make sure that your child is within about 3 months of that milestone. And a lot of times I get asked, is it that bad? And I don't want to scare parents. That's never my goal, because your child is probably healthy and happy and wonderful. And, there's a lot more things important than, whether or not their R sound is just perfectly crisp. But in general, when a child is younger, the reason why you want to investigate those kinds of things earlier rather than later is it impacts reading. It impacts reading comprehension when a child hasn't been fluent with either their language skills or even their sound skills when they're younger. It can put anything at a bit of a delay, just depending on how fast they catch up and they make up time. Even if they're, finally talking by the age of 5, that means they're still not a child who's been talking fluently for a very long time. And it's hard to expect them to manipulate language, as is sometimes required for things like reading comprehension, if they haven't been using languages fluently for as long. It's not quite as second nature for them yet. And then also it can sometimes be where other things show up, like oromyofunctional disorders. You'll see that big old OMD. That's a big one out there. There's a lot of children who have orofacial myofunctional disorders. Or maybe have difficulty with working memory, et cetera. And sometimes it'll get flagged with that. I had a screening that I did for a homeschool co-op, and I had a mama bring in 2 of her children. And one of her children, the one that she was more concerned about, I said, you know what? They're still within that 3-month range. And honestly, if you just want to get on YouTube and work on this sound, this sound, and this sound, I think all the other ones will probably pop into place. No big deal, no big worries. Call me if it doesn't work out, but I have a feeling they're going to be okay. But then the other child that they weren't as worried about came in, and within 5 minutes of hearing that sweet baby, I'm listening and I'm hearing some hypernasality. I'm seeing some different things that are going on with the mouth. And I referred them on to a specialist, and they've ended up having a full tonsillectomy, adenoidectomy, and then are in wait for a special craniofacial anomalies team because they have a difficulty with, they have a deficiency in the way their muscles form in the back of their mouth to raise and lower things. And probably all related to that, they've also been diagnosed with obstructive and central sleep apnea. And all of a sudden, the mom's like, now they're sleeping and their attention is better and their memory is better and they're learning better.
Oh, wow.
I'm like, yes, isn't that amazing how that works? Where you find all those different things and your life just gets easier because those underlying things are addressed. And sometimes it's really nice when somebody can take a peek see for you. Like I said, that free screening, it was just a free screening that I did in a homeschool co-op, and it led to surgeries, but it also led to some serious relief and just overall better life, which is wonderful. And this is where I would like to put in a shameless plug, not necessarily for me, but for any speech language pathologist. Oftentimes, if you're ever curious, oftentimes private practices, especially private pay private practices, will offer a free screening. They really do offer free screening. So take a look and see if there's any in your area if you have questions, because it can never hurt to ask. You can always ask and find out. Most people don't realize that that's a possible free resource, that people sometimes do that. Take a quick peek see for free, especially if you are part of a cooperative and you say, hey, I have 10 families that would be really interested to have you come. And then sometimes just because of the volume, they'll come just because of the volume and do a free screening event for you, which is handy. So
yeah, that's really
That's
good
a
to know.
very
I did
good
not know
idea.
that. Yeah.
Yeah. When I first started my business, I was looking around, and a lot of the other speech language pathologists were like, oh yeah, I always give free screenings because it's a great way to get to know people, and to see if you'd be a mutual good fit, because you want it to be a good fit. But then also, it's just a wonderful service that some provide, either the free screenings or some people charge a nominal fee. Honestly, it can be a great resource because it just checks that off your box. Like, yep, okay, we're fine. Or, oh, I didn't know we need to do this, this, and this. I've even seen some parents use it as a way to get an idea for what to work on while they're searching YouTube, and teachers pay teachers for resources. So, yep.
That's awesome. That's a good idea. I hadn't thought about that.
Yeah, really good idea.
So where to go from here? I just wanted to give you guys some little ideas on where you can go. Obviously, public schools, depending on where you're located, sometimes provide resources for homeschools. It just kind of depends, I know, on what state you're in. I know in my state, it's hit and miss. It's 50-50 whether or not you get resources. Is that something that y'all have?
That's Alabama. It's
Yeah.
you can go in and you're on the bottom of the list depending on funding. Yeah. Just depends on funding and what they've got and what, So it's kind of hit or miss.
Indeed. And then I know that legislation is sometimes an issue. They recently passed legislation here, and they actually kept it from being much more scandalous than it could have been. Obviously, I'm a homeschool mom, so I regard that pretty tightly. But they had it originally written in a bill that if a child received speech therapy, even just consultative services at a local school district, DCS could come into the home without your permission or your knowledge and interview your child. And they rewrote it. So now DCS can do that. The Department of Child Services can do that on school property, but not your home. But they can still do it without your knowledge or consent, which is something to consider. I know that not every family would feel comfortable with that, but other families would feel comfortable with that. It's just one more thing to think about. Obviously, there's outpatient clinics. That one's pretty obvious. And then there's private practices. And I have a lovely little spiel that I do on how private practices, they're very different. And it really just depends on your fit. Sometimes private practice sounds really bougie and expensive, but it really just depends. There's private practices that take insurance, and insurance does impact how expensive therapy will be. Sometimes for private pay patients who go to a clinic that also accept insurance, because the rate that insurances reimburse speech-language pathologist practices is based on the private pay rate. So if an insurance company says, oh, well, we'll pay you 40% of your private rate, what do you think happens to the private rate? It probably increases, right?
Mhm.
Yeah, it does. And so sometimes if you've seen like a horrible rate and you're like, oh my goodness, that's so incredibly expensive for private therapy. For instance, if you're like me and you're in a Christian health sharing ministry and you don't have normal insurance, and that out-of-pocket expense, you're just like, it's bedazzling. It's so
Yeah.
expensive. Also consider looking for a private practice that only does private pay, because while it could still be expensive, I don't know, it just depends on the speech language pathologist, I guess. They do not have their rates determined by an outside party, which is sometimes nice. They also can potentially see you less often. If you just want like a guiding hand, like once a month or something, private practices sometimes can be more flexible with that. There's also those big teletherapy companies that have service everywhere. I personally have not seen a whole lot of reviews from that, but I do think it's very intriguing that you can pay like one monthly fee and then get whatever service you need. I think that's kind of interesting. And of course, there's all sorts of apps. I love Little Bee Speech. They're super cute and very fun for practice. YouTube. I love Peachy Speechy for speech sounds for the most part. And I love Laura Mize, her YouTube. She has so many free resources for little language learners. Just fantastic. Then there's books, there's printables, and of course, there's also courses out there too. Some courses are for the children, and some are to train parents how to work with their children. So there's just a wide range that I wanted to overview for folks.
That's awesome. We have a lot of resources.
Yeah,
We really
absolutely.
do. We really do. And I think one of the hardest things for me is meeting a parent who went, oh, if only I would have known that was an option. I would love for every parent to know all their options so they can find their best fit. That's definitely a lot of, as you can see, my branding is a little lightning bug, because my goal is to shed light, illuminate, communicate. There have been so many places that I've worked where I'm either not allowed to share different options because it could get us in trouble, kind of thing. Or, obviously you're not allowed to shed light on the competition, but I'm thinking, but if it's the best fit for that family, it's the best fit for the family. One of the things I love about homeschoolers is they're all about finding that individualized fit. You can individualize like nothing else in homeschooling. It's one of the beauties of it. So yeah, I love that. Love it.
So, that's a lot of interesting information. You got questions, Susan?
Yeah, I was, I don't know if you guys know, I took a couple notes here. One is I want to kind of recap some of these resources that families can go to, that asha.org.
Yes.
I thought that was a really great point. But again, those last two resources, one was Speechy Peachy. Is that what you said?
Peachy Speechy.
Okay.
Yeah, because we love tongue twisters as a speech language pathologist. I mean, I can't judge her. I mean, Illuminate, Communicate, Peachy, Speechy, I can't judge. I can't throw that stone.
And what was the other resource again, if you could repeat that? Because I think that would help
Laura
parents.
Mize, Mize, and she's a great one for if you have a child where you have concerns that they might not have underlying social language skills. I actually use some of her ideas to inform my practices with even my older children with social language concerns. But she has great free resources on her website as well. It's really fantastic for the little itty bitties, the ones who are, 1 to 5 year old. that's a perfect sweet spot for Laura Mize. But you may get overwhelmed. She's got probably over 500 hours of podcasts and videos up. She's a wonder, and quite obviously she's very prolific, but she's been doing it a long time and her stuff is very solid.
Wonderful. Those are great resources. So Amanda, I know that one question I want to ask you is, I know that you're in Indiana.
Mhm.
Can other parents outside the state of Indiana reach out to you?
They can for certain things. I'm actually really excited about it. Starting in January of next year, there's a thing called the Interstate Compact that's going to be going through, and my state is one of them. I believe your states are too. And it will make it so that I can serve families in many states. And I'm very, very excited about that. Because one of the things that I really want to do is provide that kind of consultative, collaborative role where I work with a family and figure out what the family needs and what their child needs within that, and then equip the parents to meet those needs. That just, that gets me. I love parent coaching. I love parent training. I love to equip parents because, like I said, they're the secret sauce. And I know that with a lot of homeschool families, that's the way to roll. You maybe, you come and you get a little assistance once or twice a month if you feel like you need it, maybe even every week. But, to have that kind of flexibility, I think is a really big deal for a homeschool family, especially when you have so many other things going on and, you're educating your children all along the way too. But for now, I do have my Facebook group. It is Speech Therapy at Home Community. And I have people from all over the world, and I do lives, I do Q&As. I talk about all sorts of different topics that moms want to chat about. For instance, we did an impromptu live where a mom did a shout out that she was working on the L sound and the American Revolution. And we were like, boom, let's make a unit study. Just to give different ways of practicing things within the homeschool day. And that's been a lot of fun. But I'm looking forward to it as it grows. Right now, I can serve families in different places through courses and through that support group. The support group is free, which is super fun. But those courses, I have my first one rolling out, which will be to learn the 4 strategies that can they're so flexible. It almost hurts. I could talk about them for forever too, but I won't. But these 4 strategies, you can use them to both teach your child who is not talking to talk, all the way up to correcting your children's use of verb tense. They are crazy cool strategies, and I've used them myself in my own home while my hands are covered in whatever. So they're just super flexible and easy. And that will be coming out in June. And then I will have another one coming out in July called Teach Any Sound, because there's a lot of great YouTube out there, but nothing necessarily step by step, or nothing that teaches you how to practice, because there's some ways to practice that give you a lot of bang for your buck. And then there's other ways to practice that are maybe fun, but maybe just busy work. And they don't necessarily give you the repetition and the contrast that you need to really teach a child's sound system how to grow.
Wonderful. And if they wanted to reach to these classes, and you said you're releasing them in June and July, would they go to your website to access those classes?
Yes, that would be a great place to go. And then you'll just look through. It has a link to my courses. My different courses are on there, and they're wait lists. So right now I'm collecting families for wait lists, and I have a couple already waiting there, so that when those go live, we'll be able to kind of go through it as a cohort.
Wonderful. And of course, obviously, the parents, mamas from Devin's group and my group, by all means, can certainly drop us a note in the comments area below this workshop and ask any questions. And Amanda is going to answer your questions or send you in a direction, give you some guidance on that as well, to kind of get you on the right track.
Indeedy. And I actually have been collecting contact information for private practices across the nation, including specifically ones who either have homeschool experience or who are connected themselves to the homeschool community and have a positive view of it. I had to make that qualification the other day. I wanted homeschool SLPs. I wanted speech-language pathologists who have a positive view of homeschooling, because I think that's really key. I think that's really important. So I'm collecting those. So I'm going to be hopefully a little bit more ready every single day that I get another one, to give information for people regardless of what state they're in. I'm still missing a few states, but I'm getting more and more information.
Wonderful. Very helpful. Thank you.
Well,
Great
Amanda,
information.
I want to just say thank you for all your help for the homeschool community, because it's something we need.
Absolutely.
I appreciate
Wonderful
it.
information. Thank
It is
you.
my community. So I really appreciate that. It was actually part of why I started my business, because I was told we're not going to serve homeschoolers anymore. But that was about the same time that I found out about that legislation. And I was like, well, I'm not sure we want to serve homeschoolers anymore. I want a better option for homeschool families.
Yeah.
I want one that's more than the therapy that I know is not going to necessarily be enough for them anyway. But I know that outpatient clinics are not an option for everybody. They just aren't. They wouldn't be an option for me based on my insurance type. Basically, no insurance.
Yeah.
And that's why I started this whole thing. So thank you. I appreciate that, your kindness. I'm really grateful that you guys do what you do, because homeschooling would be so lonely if we didn't do it together.
Yeah, it would be. It would be awful.
Absolutely. That's why it's so important to have your community, whether it's a local community or a Facebook community, or
Or
find
both.
yeah,
Yeah.
find your family, find
Yes.
Yeah. Find your people,
your
your
tribe,
tribe.
Yeah.
Yeah, because I mean that's how we get better and we get stronger when we help each other out.
That's that iron sharpening iron kind of thing. I love that.
Yeah, absolutely.
Okay, mamas. Well, we're going to wrap this up. We have another one coming up with Amanda in I guess a couple of weeks, and that one's my child needs speech therapy now. But I don't have time. That I was trying.
But I don't have time.
That's how I feel about my life.
Yes.
I don't have time. But so y'all don't miss that one. And I totally think we need to do the picky eating. I'm so curious.
Oh, it's a fun one.
So curious about that.
Yes, truly. Yeah, I've actually done that one with a nutritionist, and we were bouncing ideas after each other going, oh my goodness, yes, so that's why that is. And just like putting all those pieces together. It's interesting. Picky eating is an interesting deal.
Yeah, I'm very curious about that one. We'll have to talk. Anyway, y'all have a wonderful night. We appreciate y'all. We will see you soon. I'm saying goodbye. Bye, Susan. Bye,
Bye, everybody. Thank you, Amanda. Bye, everybody, for joining us.
Bye.